heading to the hospital with a broken bone or a bad bug, and you expect to answer questions about your allergies and health history. But soon, whether you visit the ER or the dermatologist at Massachusetts General Hospital, you'll be asked how often you have 6 or more drinks and how frequently you've used illegal drugs in the past year. MGH isn't the first hospital to screen for substance abuse. Boston Medical Center started asking these kinds of questions in its ER 2 decades ago, as have other local hospitals in recent years, including Beth Israel Deaconess, Brigham and Women's, and the Leahy Clinic's Addison Gilbert Hospital. What makes MGH's screening policy different is that it will be hospital-wide. So is this an effective way to diagnose substance abuse? Dr. Timothy Willens is the director of the Center of Addiction Medicine at Mass General, and we say welcome to him today. Thank you for being with us.
Thank you so much for having me.
So tell me what prompted MGH to do this.
The MGH was set upon in what they call the strategic plan to better understand what are major illnesses that affect MGH in a community and which 1 or 2 diseases that they could take on as a hospital system and really have an impact on that. And they picked substance use disorder. The leadership actually sat down, looked at a number of proposals and said, we're really worried about that. We need to come up with some solutions. Right,
so clearly doctors and administrators there see substance abuse as a real issue in our society as a whole.
It does. We know that 20 to 25% of inpatients on our medical floors have substance use problems. We know that 20% of the general population have a lifetime history of substance problem. And we know that this problem is growing. There's more and more individuals coming to our emergency rooms. There's a lot of high-profile cases, opiate overdoses, and things like that. And so the hospital leadership said, we really need to start doing something about this.
Sure. So they're going to implement this new program. So let's talk about the program itself. And it's not that people haven't been asked, do you have issues before? But now it's hospital-wide.
That's exactly right. So first of all, it's a multifaceted approach to substance use disorders. It starts from a reconceptualization of substance abuse and that getting out through education to our hospital, the practitioners, and into the community that doesn't see it anymore as just a single episode illness that may be morally motivated. Mm-hmm. They see it as a brain disease that has with it sort of a chronic course. That is, you may get better, but then you may relapse. And then you have to account for that. You have to change your management into more what we call recovery management or disease management. More like diabetes. You may get better from your diabetes, but we're going to have to do an awful lot to monitor that. So part of that is then identification and screening. In addition to that, we're going to have a team that goes around the inpatient unit that's specifically focused on addiction to help motivate people who are not there yet in terms of understanding where their addiction is. And then we're going to help connect people into the community. And by the way, we're going to be working with community providers and part of the MGH family and other vendors out there to try to bring together really a web of understandable places for people to go to get their addiction treated. We're going to have people that help people through different phases of the navigation of what can be a very complex system. Sure. And we're going to then have adequate follow-up, build into the system adequate follow-up so we can really take care of people.
Okay, so let's go back to the beginning, though. And so I'm someone who's come into the hospital, and I'm asked a few questions, because I have to figure out how asking these questions leads to what you've just said. So what kind of questions would I be asked?
Well, we're going to ask 4 basic questions. First, we're going to ask how much alcohol you use at a single setting. In other words, over a period of time do you drink more than 6 drinks?
And will people answer that question?
Well, they do actually. And it turns out that the questions we're asking actually come from the National Institute of Health, and they're very sensitive screeners. Mm-hmm. They may over-identify in some cases. And so it's not like we're going to whisk you off to a detox or label you that you have an addiction of some sort because you screen positive. What it means is that it says that you have at-risk behavior, and we're going to want the medical team or your doctor or nurse practitioner to sit down with you and start a conversation around your behavior. If it turns out you're drinking 6 drinks in a period of an hour or 2, that could be a problem. If, on the other hand, you go to a Patriots game and you're drinking light beer and you started at 1 o'clock and you went home at 10 o'clock, that's a different scenario. Sure. So we're going to want to know more about the context.
Sure. Now, if some of these patients are in fact admitted maybe for another purpose, you've got an issue with your tummy or some such thing, there could be what's called a bedside intervention. Explain what that is.
So the bedside intervention would be that we would say, there could be a problem here, and we're going to ask you more about it. And let's say we determine that, in fact, you're using hazardous levels of drugs or alcohol. We're going to want to sit down and we're going to want to work with you and your family, and we're going to want to enhance your motivation to start seeing this potentially as a problem, or to help you start saying, maybe I'm drinking too much and I should cut back my drinking. Maybe I'm smoking, I should cut that back. Or if I'm using drugs, maybe I ought not be using drugs. So it's not all or none. It's not going to be, well, if you're not abstinent, then it's a failure. We're going to see it as we're going to step in and meet you where you are, and then start an intervention. And we're going to try to teach everybody in the hospital how to do some of these interventions. And we're going to work with specific teams that can then work with, who have more expertise to work with people who may have more problems.
Right. You're actually hiring some people who are going to come in and take care of this.
That's exactly right. In fact, one of the strengths of the community component of this is not only linkages in the community to help people with different kinds of programs that they may not know exist, but we're going to have people who are in recovery and have additional training actually come from the community that you live in to meet you if you're on the inpatient unit and say, hey, for example, I'm Joe, I live near you in Chelsea, and I'd like to take you to first AA or NA meeting, or I'd like to stop in and see how you're doing in a couple weeks, or I want to be sure you make it to your first counseling. It turns out that one of the biggest difficulties we have in addiction treatment is the transitions. If we make a referral and we tell you to go call somebody, people typically won't do that. So we want to help facilitate that.
Right. It's hard to do that on your own and to take those. It's scary.
It's scary. And then it's hard to know what's the right place to go. And you go there and it's the wrong location, they shut down the meeting. So we want to help facilitate that.
Doctor, let me change gears just a bit. Let me ask you real quickly, when will this be implemented at the hospital?
We're going to be starting in the fall of this year. So it's just a few months away.
Great. Let me change gears just for a second here. There has been a real issue in the last year and a half with a drug that's called Molly. It's a drug that seems to be attractive to young people. Talk to me a little bit about Molly. What is that?
So that's a great question. Molly used to be thought of as just what I call turbocharged ecstasy. Ecstasy is the chemical name is MDMA, and what it is it's a weak hallucinogen linked with an amphetamine. So you've got I feel good, empathic kind of drug. I understand. At high doses, I hallucinate. With an amphetamine, I have a lot of energy. Molly was ecstasy that was purified, sort of a crystalline form. The problem is it's changed, it's evolved. So Molly could refer to that, but in fact, the DEA data would indicate that only a small percentage of Molly is that now. Now it's what they call synthetic cannabinoids, which are these class of medication drugs that have very strong properties. Lots of hallucinogenic properties, they create paranoia. The amphetamine is methamphetamine in a lot of this, so you get with that a lot of the methamphetamine problems, which includes paranoia, cardiovascular issues, problems moderating your temperature. And people are taking this and they don't know how much to take because it varies. It's coming from overseas, often from China. People are putting these together, chemists, they call them, street pharmacologists. And so you've got these young people taking them, and batch to batch, it differs massively. So you don't know if last time you took this amount, it worked. This time, that could be an overdose.
It's a scary thing. I think education must be what this is all about when it comes to our young people. We've got to teach them that this is a bad thing.
Absolutely, and that actually works, because if you can help kids understand that this is a problem, there's negative connotations to it, kids actually will stay away from it.
Dr. Tim Willens, we're so glad you could be with us today.
Thank you.
Thank you, sir, very, very much.